Jesus.
No filler in mine then.
Wow. All killer. No filler.
We're done in a minute.
Fuck you,
I'm going to
Tom
tell you what I
Cruise.
took away from that scene.
Whitney's not having it.
Oh, shit, I wasn't ready.
From
Fabulous Las Vegas, Nevada, this is Pod Therapy. Real people, real problems, and real therapists. You can submit your questions anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. And now, broadcasting from the churn, that's Jim. That's Whitney. I'm Nick. It's time for some
So
Pod
Tom
Therapy.
Cruise on the no-no
Okay,
list.
no.
You're not hitting that.
No, here's my thing. Here's what stuck out to me in that scene is that Tom, the whole movie, well, okay, not the whole movie, because in the beginning he's lackadaisical.
A few
but then,
good men, for those of you just
oh
tuning
yeah,
in.
a few good men. But then once he's serious about it, he's like so hard on himself. But then he just lets her get away with like a really big no, like, oh,
Yeah.
you just attacked the judge or whatever verbally, and then he's
Okay.
like, no, it's fine. Like, don't bother her about it. And
But
I'm
it
like, you
clearly-
cared so much about your own actions. Maybe it's just that
Doesn't
it's
it
Denise,
clearly indicate that he cares about her?
No, it
No,
doesn't.
it
Because
didn't.
earlier
It
in
didn't.
the movie, he made a point when they were preparing for court. He's like, whatever you do, don't show a reaction. Always just show that whatever happens is exactly what you thought was going to happen.
Okay, yeah.
Never have
I
any
do remember
reaction to
that,
anything.
yeah.
Okay.
Yeah.
So that's what he did
But
when
she
she
made
objected.
a mistake.
Yes. And so he didn't react to it.
Okay, Jacob's pulling up
See, he
photos
looks
of Tom
goofy.
Cruise. Why does he look like he's getting tortured, Jacob?
I don't remember
know.
that part in the movie.
What kind of weird
See, look at
smut
the
are you putting
filler.
up here on the
the
screens?
filler. Like the filler.
He's not got filler. It's just blood
Wait.
rushing
Oh no,
to his cheeks.
current Tom Cruise has got some filler.
Oh,
Current
Come
Tom
on.
Cruise is
It's
oh man, they
not
every
great.
year they do this thing where they're like, remember this actor in this movie? He is the same age in this movie as Tom Cruise is right now.
Oh, right.
And it's just like,
It's always really
It's like
weird.
Gene Hackman.
yeah, I think the last one I saw was Gene Hackman in some movie, and it's like,
yeah. How is
Or
Tom
Jack
staying in there?
Nicholson.
Yeah.
Like,
Yeah, it's him
Oh.
and Paul Rudd. That's the other one. It's like
Oh,
Paul
yeah.
Rudd is 85 years old.
yeah.
Paul
he
Rudd,
never-
I think, is a little more natural, though.
Yeah.
Yeah.
No, I
I
don't
think
think
that's-
Paul's cheating, but
yeah.
Yeah,
he's
that's
getting
true.
there, honestly.
Oh my gosh.
So
no,
Tom's on your
and Jack
no-no list.
Nicholson being like the major colonel, whatever
Yeah,
person,
yeah.
and he breaks down on the stand.
Oh, you don't.
No.
Oh, you're rolling your eyes at
Yeah.
this great cinematic masterpiece that you find unbelievable.
Yeah.
Okay,
I do.
Jack was pissed. Oh, come on. He's a little bloated. Tom's a little bloated.
yeah.
He's looking a little puffy. Okay, and that's
All right.
fine. He's like 80.
What's
Let
the
me
name
ask you
of
this.
the
He's
Lord
62?
Xandar or whatever?
Jesus, he looks so good for
let me ask you
62.
this.
L. Ron Howard.
Yeah, 62.
Battlefield Earth, good movie or bad movie?
Great movie.
Then
I
shut
rest
the
my
fuck
case.
up.
Great.
That's
movie.
it. We're
Jacob,
done.
shut the
That's the
Great
end of the conversation.
John
All right.
Travolta. Forrest Whitaker.
Did anybody email any questions
All
in?
right.
Look,
I'd love to
Jacob's
talk
like,
about.
Jesus.
yes,
I'd love to
go.
talk about people's horrible mental issues.
The resume
than Tom Cruise.
on Battlefield Earth.
Thank you.
Impunable.
Did anyone write in
Unimputable?
about like any horrible things that happened in their childhood
They'll
that we
be
can talk
fine,
about?
Jacob.
Jacob's very excited
They'll
about that.
be fine. Jesus.
I just can't do another show where we talk about Jim's
All right.
bad movie taste.
I need to hear discussion in the Discord, and here's my premise. Those of you who are wondering what my stance is. My stance is Tom Cruise chastises his co-counsel, Mr. Pollock guy, and it's clearly got
Why
a
are we
little bit of
rehashing
an
this?
energy
I
of
can't
like
think of a
a
single
little
reason.
overly chastising.
I also
The
made Peter
dumb
watch
thing
Legally
about
Blonde.
this-
Can we talk about that?
The dumb thing about this is, even if you're right, it doesn't matter.
That's fine. I just didn't like the plot device because it felt arbitrary because like they're buddies the whole time. They get along. And now all of a sudden he's calling his buddy out
He can't get
in a
mad.
way that's a
He
little
can't have
aggressive.
A bad day. He can't be pissed.
No. It
Nice
look,
guys get pissed
among
too.
dude friends, I think you can think about.
No.
Oh, hold on. Somebody's here. Hello?
Oh, it's a messenger. Nobody gives a shit.
God damn it, Jacob.
No,
You're
but here's
stepping
the
on
thing.
fine art.
The other thing, though, too, you're wrong about every point
No,
of this
I'm
movie.
not.
They're not friends.
Oh, hold on. I got to check the door.
They are
again.
not
Hello?
friends.
Yes, and nobody gives a shit.
Jesus. This
They're-
guy will not go away.
They
They're
still don't give a
coworkers.
shit.
Yeah, but he's
They
being
were-
a weird coworker because he likes to me more, and it's weird. It's like if you secretly had a crush on Whitney.
Jim, someone's at the
and then
door.
I was
Answer it.
slightly critical of
Jim,
Whitney.
answer
and I
it.
was like, Whitney, that doesn't make any sense. And you
I'm
were like,
gonna answer it
Jim,
if you don't.
leave her alone. She's trying her best. Let it go. And I'm like, Jesus, dude, what are you doing? Like, it's clear you have feelings for her. And this is awkward. Oh, hold on. I got to get the door. Jesus. Hello.
Wait, are you know about Tom Cruise?
Yes.
Oh, that's great.
We love him.
Patreon.com/therapy. Hear the whole
Give us your
conversation
thoughts.
and get my whole take on this. And I want to hear about this in the Discord because people are going to agree with me. I feel like I'm on the high ground on this. People are going to be like, look,
Jen's
bro
always
code,
so
it was
optimistic.
weird. It was
I typed
weird.
it. I sent a message in the Discord this week.
Oh, yes,
I
you
saw
did.
that.
Yeah.
The fans were thrilled.
I don't remember what I said, but
Nope.
I remember saying something in the
So
Discord.
you jumped in and you had a comment, and all of a sudden, everybody lost their shit. And they were like, oh my God, Jacob's here. And my immediate comment was, 2 hours later, I was like, I promise you, he doesn't remember sending this.
I remember sending it. I just don't remember what I said.
I'm gonna have right on that.
Yeah, you're not totally wrong.
I'm not all
You're right in spirit a little bit.
Thank you.
You're
Spirit of the law.
partial
Spirit of
credit
law.
in spirit.
I'll take it. I'll take 100% of
Yeah.
all that. Patreon.com/therapy. People are feeding the ponies for Mental Health Month,
Good.
which we appreciate at patreon.com/therapy with a little store going on.
And
for-
Emma says something to the pony each time somebody feeds it,
she
right?
lets you know. Yeah, she lets the pony know this was sent by Jacob. He wants you to have this carrot, and the pony, you can tell, appreciates it.
Yeah.
And so that's well done. So ponies have had, I don't know which pony gets fed. It's a little bit of both. But they've had ice cream at this
Good.
point and carrots. I believe watermelon's on the way.
Great.
This is always getting posted to our Instagram page at PodTherapyGuys. So even if you're not going to contribute, but you'd like to watch ponies getting fed, make sure you're subbing to that Instagram page. And if you'd like to feed the ponies, patreon.com/therapy. A good time of year to do that. And we've had folks contributing gift memberships, donating memberships at the Therapod level and higher to make sure that there's folks out there that would like to get access to the library of extra content and just be part of the community, but maybe finance has been a little tight. Well, there's sponsorships now. So all you have to do, message us privately, podtherapyguys@gmail.com. Let us know, hey, if there's any free memberships, I'd like to be on the wait list for that. Great. And when they become available, we will contact you privately. That is all anonymous, and we'll say, here's your code. Go ahead and click this. And when you click it, boom, you're in the
And
group.
How do people set up the free memberships? Like if I want to buy a free membership for someone else.
Great question. Patreon.com/therapy. It's
Great.
right there. It's right there. You scroll down. It'll say, hey, do you want to buy a free membership, gift membership? Bum.
We're actually, if you have it in your heart to do that, that'd be great because we are out of free memberships to give away. Nick has actually claimed all of the other free memberships after buying sushi for everyone.
He's running a little low on finances.
He's a little tapped out.
leveraging free memberships now to pay utility bills.
Yeah.
It's been getting a
I'm
lot.
reselling them.
Yeah, that's right. Which is fine. That's the purpose. The purpose was they just go to somebody who needs them.
The horrible part, though, is he's reselling them at a loss.
Yeah.
Even though they're free.
Yeah. It's real bad.
Somehow he's losing money.
Yeah, he is not good at this.
Oh my God. Well, thank you for everybody who's been supporting us at patreon.com/therapy. It's been a really great time. Just love everybody. So many people in upgrading their memberships and just being like, hey, here's some extra, money in the hat.
That's awesome.
Appreciate you guys. And so we really appreciate it. And then buying free memberships and people reaching out and saying, hey, I'll take one. It's great. So, and again, remember, if you do take a free membership, it's completely anonymous. We're not going to announce you any differently than we do anybody else. Nobody in the world will know that you took that free membership, including the person who donated it. They do not know. They just literally send us the link and say, hey, give this to somebody who needs it. And that's the end. So nobody will be the wiser of it. Take that free membership. Nobody cares. At the end of the day, we're just here to support people. And we just want to make sure this content goes out to people who need it. So,
and if you support us on Patreon, you get access to our Discord.
Yes.
Where I posted this week
where
that I
Jacob
own
is featured.
22
Crazy.
pairs of shoes.
Totally crazy.
Yeah.
And
that
then
came out.
I think I said 22.
You
and
recounted.
And then I went through and counted, and I had 22 pairs of shoes, and then I found one more.
Yeah.
And so it was 23, and since then I found another one.
So, Whitney, last episode you weren't here.
No.
And Nick brought up his spring cleaning, going through his wardrobe. And we all started comparing notes on how many shirts we had, how many hats we had, how many pairs of shoes we had.
Okay.
It was more than you'd think.
How many bras did y'all have?
It was not as many.
More than you would think.
Okay.
More than you think. Yeah,
It
it's
wasn't
not
zero.
zero. But they were trophies more than anything. Yeah, they're really just triumph.
Saves my back pain.
Yeah. It helps with my back.
Yeah. Gotta hold these things around.
That's right.
It sucks.
Keeps me right. I'm curious because obviously the representing female on the team here, we didn't get a chance to ask you. So if you had to ballpark, how many shoes you have?
Pairs of shoes.
Pairs of shoes.
We don't
Thank
want,
you.
we
Thank
don't
you,
want
Jacob.
individual shoes.
Yeah, we're not counting individuals. That's dumb. But if you had to think about it, now I think Jacob probably had the most. I think you're pretty up there with 20 something.
Yeah.
I was probably less than 10. I mean, I had maybe 5
I'll tell you what I had
shoes.
more than I realized I had is boots.
The boots
which is a
added
weird
up.
thing to have more of than you think you do.
You know, man, you think that it would be too many, but honestly, boots can be pretty versatile.
Oh, yeah.
And I like them.
Oh, and I use all of them.
And you're counting cowboy boots in that?
Yeah.
Are you counting hiking boots in that?
Yeah.
Okay, and dress boots.
Yep.
There's a lot.
Yeah,
Work
hiking
boots.
boots. I wasn't even counting
with
those in
work
my head.
boots. In your defense, that's a pretty versatile group.
Yep.
Nick
Oh
had
my
quite a
gosh.
few of everything,
A
including
buddy of mine from Australia just sent me a new pair of Australian work boots.
Okay.
I forget the brand of them, but they are great.
They're made of kangaroo.
They're not made of kangaroo, no.
Okay.
I believe they're out of Tasmania.
They're made of Tasmanian devils.
They're made of Tasmanian devils,
Of
yes.
course. Oh, that's
They are super comfy and
bet
super
that's
like nice quality.
They spin you in
and he
circles.
was like, everybody in Australia wears these work boots to work in because they're just wonderful.
So you are the hippest
And he's
American
right.
Australian.
They're very plain looking boots,
Okay.
but they are
They
perfect.
work.
Yeah,
Oh, I like
they are so
that.
comfortable and they are just hardy.
So Whitney, how many shoes are we talking here?
I would guess off the top of my head, between 35 to 40.
All right.
pairs.
God damn.
And I don't feel like
I was going
I
to feel
buy a
so
lot
bad
of shoes.
if she had less than me.
yeah, she's like, I don't know, 5 to
To
6.
be
yeah.
fair,
Yeah.
She's
I
like
have
20 even.
Yeah.
I know. I have a really hard time letting go of like good shoes that I have that I haven't worn in years. So I have like 2 really good
Okay.
sets or pairs of like heels that are open toe. They're like a little
Right.
bit dated now, but they were
Okay.
really quality shoes. Now
Yeah.
I'm like they're just going to come back around in another
You're
like
just
5
waiting
years.
on
Or
it.
am
I
I?
have one pair of dress shoes like that. They're a specific
Yeah.
style of dress shoe that and like I didn't buy them. I think SJ bought them for me.
Yeah.
And
Is this like zoot suit shoes? Like they got the
no,
wing tips and
nothing,
the white.
nothing like that.
Ah,
it was
that'd
just
have
a style
been
of
fucking
shoe
cool.
that was in style a few years ago.
All right.
And but they're super nice. They're
Yes.
super nice quality.
When
You're
you want a
waiting on
nice
those to
pair
come
of
back
shoes,
around.
and they're just good quality, you're like, I might wear them once in a blue
Yeah,
moon.
yeah.
But
I mean, why throw them out?
These are the ones that are a little bit longer and they've got the squared off toe. Do you
Oh, I
remember
like
those a few years
square
ago?
toes.
yeah.
I
No,
like square
toe is good, but these are lengthened a little bit
I
too.
just
Ah.
I just donated a pair of those.
Yeah.
Because
just
I was
did the
like
spring cleaning.
Yeah,
Like
'cause
when I remember when SJ got them for me, I was like, these are going to be out of style
Yeah.
soon. I don't
And
know
they
what I'm going
were.
to do with them.
they were.
Yeah.
It was a very quick
These
thing.
are like
Yeah.
Jim
those shoes.
Carrey the mask shoes. I mean, just
What?
long, curly.
Oh my
like-
gosh.
Yeah, that's it, Jim.
You know what I do
They're,
have?
they're elf shoes.
Got it.
They curl up at the toe.
Yeah.
I have a pair of shoes from 7th grade that
Oh.
I still will wear.
They still fit you.
Yes, because
Wow.
girls stop growing. I don't know.
Okay.
I mean, not all women, but
Yeah,
most
yeah, yeah.
women stop growing, I feel like, by 6th or 7th grade.
Wow.
Yeah. They don't keep growing through
Dude,
high
you know how
school.
kick ass that would be to still get to wear your shoes from fucking middle school
They
as
are,
a dude?
they're Doc Marten boots.
Dude, I had fucking Sonic tennis shoes.
and
in
they
middle
are molded
school.
to my foot.
Yeah.
They are so
Oh.
comfy. They're the like made in England ones
Right.
now. And they were
Ooh.
expensive. I remember they were over $100
Oh,
in
yeah.
like
Oh,
what was that
wow.
night like 2000?
What brand are these?
Docs.
Doc Marten.
Oh, Docs.
Yeah, Docs.
Okay,
Mhm,
yeah.
mhm.
Those
No,
are
I had a good
So-
pair of Doc Martens in high school. I think I must have grown out of them because I don't think I would have gotten
I
rid
know,
of them.
guys.
No,
It sucks
we
because y'all
outgrow
would
those.
like
middle school.
Keep growing.
You're not
Yeah.
even
Yeah.
done.
No.
Yeah, you got a
That's so
long road
weird.
ahead of you.
Yeah, so I have those. I also had a pair of Crocs from like high school still, but I
Really?
just threw those away
Were
the other
Crocs
day.
around when we were in high school? I don't remember them being a
They
thing.
were, and then they went out, and now they're all back.
They did have a weird, like, this is a joke, and then
I know, and then
all of a sudden,
unironically,
everybody had them
y'all, the
in.
guy at the gym next to me, the teenager at the gym next to me, was working out in Crocs, and I about lost my
I'm on his
goddamn
team.
mind. I'm
Yep.
like,
I'm
There's
on his
a-
team 100%.
What
Guy at
thoughts?
my gym that does that
what
too.
What are your thoughts on this mental
Terrible.
fit? It, like,
Come on.
Yeah, no,
If you're
no,
just
no.
being stuck up.
I'm not
No.
being stuck up. It's not good.
I mean,
It's
watch
like-
how like
You know what
wobbly
we
your
at Planet
ankles
Fitness
are.
call you? A lunk. All right, and we have an alarm for people like you. All right.
You mean knowledgeable?
no?
about
the
what
lunk
I'm doing?
alarm. We're not putting up with your bullshit.
No, you need harder sole shoes.
Yeah.
You can't.
Why?
Because your foot is
Stability.
if your
Yeah.
foot is like standing on a pillow, there's no
That
stability.
hurts my ankles.
Okay.
Just
Yeah,
thinking of it.
and
I, like,
so-
But it's
cringe.
not leg day.
But when Jim shows up and just
This
wanders
guy
around
was-
the gym for a little while
Yeah.
and then
Oh,
leaves,
sip some
there's
water.
plenty for that.
Yeah,
I like to
yeah,
sip
yeah.
some
For-
water.
for what Jim does.
No,
there.
I like
yeah,
to
yeah,
spray down the
meandering,
machines
fine.
a little bit,
This guy
clean
was
them up,
doing that
you
little
know?
like leg press,
Oh,
but
yeah.
he was like
Yeah.
clanking it too. It was like clank,
Oh.
clank, and his Crocs. I was like,
Oh.
I am about to
No,
lose
not
it on
good.
this.
Yeah.
guy.
You guys are
Not good.
judgmental. All right, we don't
Good.
allow that bullshit in Planet Fitness. Okay, we
Well,
accept everybody.
UFC
Okay.
fit. So.
You-
Slice of pizza on the
you
way
accept-
in. Relax.
You accept everybody. Except the people you call lunks.
Yeah, no, fuck the lunks. All right, the lunks are out. We have an alarm for you assholes.
They accept everyone.
We're not
Very
having
accepting.
it. Yeah, it is okay.
Very
it's a little
accepting.
ironic. It's a little ironic.
Little ironic.
It's a little Obi-Wan Kenobi. Only the Sith deal in absolutes, but that was an absolute statement. So a little off. But I'm. You know what?
Yeah.
I stay with my tribe. Tangeman. I'm not fucking around with
No.
this.
I'm gonna go count
there's
my
a list
shoes.
of people that won't be allowed into Planet Fitness.
There's
And the people in the tribe are right up there.
all of them.
Yeah.
Patreon.com/therapy.
Very anti-Semitic over there.
Support us for Mental Health Month. Boy, do we appreciate it.
Yeah.
And feed the ponies while you're there. Why
Yeah.
not? It's a great time. We will post the videos. It's a great opportunity. And you get to watch ponies literally enjoy ice cream. That's lovely.
Are we going to start the show?
Well, let's do this show. We've
do
got some
it.
great questions today. And the first one, my boyfriend's body dysmorphia. Dear Whitney, Jim, Nick, and Dr. Jacob.
Good evening.
Long-time listener, first-time question asker. I'm hoping you'll answer this one, even though it might be better suited to a Pod Therapy After Dark episode.
It is getting late.
It is getting a little late here in Las Vegas. I think we should pour some whiskey and answer this question. I'm a woman in my late 20s. I've been with my
Ooh,
boyfriend.
with the lady.
Ooh, a lady. I remember the first time you ever did that. And then, I just remember just laughing my ass off and then realizing it was a
man.
reference
Yeah.
to the ladies' man. That works on so many levels. I've been with my boyfriend, to make it easy for everyone, I'll call him Reservoir, for
Thank you.
just over a year now. And I think he could be the one. He checks a lot of boxes.
Not with
for
that
me.
name.
He holds water.
He holds water for when I need it. He is kind and funny and emotionally intelligent, but there's one issue that he can't seem to get past, and I'm starting to wonder if it's deeper than just a mild insecurity. Reservoir is extremely ashamed of his body. And, well, specifically, I'm referring to his penis. He has a natural curve, which to me seems completely normal and not a problem. But he talks about it as if he's burdened with this horrible deformity. And he gets visibly anxious during sex and refuses to be seen naked with the lights on whenever possible. He even avoids certain positions because he's afraid I'll notice or be grossed out. It's a penis. I'm not grossed out. I mean,
Jim,
no more than...
keep reading the letter.
Huh?
Keep reading the letter.
Okay.
We don't need your opinions.
Oh, sorry. I was stepping away.
Yeah.
You're right. Let me get back to what was actually written.
It's a penis,
I'm
fellas.
I'm not
Nick,
grossed
put that away. It's a penis. I'm not grossed out. I mean, no more than any other penis I've ever seen. Let's say in my life. To make matters more complex, he's told me that when he was a teenager, his mom once walked in on him changing and made a hurtful comment about it, something alluding to it being bent, and therefore he might be gay and not straight. He says he brushed it off at the time. Jesus Christ.
I only want to talk to this person's mother now.
I know.
Yeah.
The end
I
of
have
question.
so many questions for your
New
mother.
assignment.
Yeah.
Let's discuss.
What did you think was going to happen when you
Wow.
criticized your son's
And just
dick?
way to jump in on that and just go right for the
Yeah.
balls. And
Yeah.
just like, hey, you're gay. He says he brushed it off at the time, but it clearly bothered him. I've tried suggesting that he talk to someone or look into counseling, but he flat out refuses. He won't consider medication, therapy, or even reading articles that might help him gain perspective for fear of someone getting hold of his browser history. He insists that it's somehow his burden in life to carry, and that I'm only being nice out of pity. Honestly, I'm getting exhausted trying to convince him that I see absolutely nothing wrong with him. I wish he could see himself through my eyes. My questions are, could this be a form of body dysmorphia? How can I support him without pushing him further into a shame spiral and keep him from completely shutting down? Thanks, signed, not bent out of shape about it.
But
Oh man, nice.
Thank you.
Well done.
Excellent. Yes.
Well,
Whitney, go ahead.
yeah, my penis that's bent.
Yeah, tell us about it.
I know. I hate this for you, Ryder. That is, and that mom. Oh my gosh.
Oh my
That's
goodness.
a weird take from mom.
I mean, your mom judging your penis at all.
Yep.
I mean,
Without the gay comment.
I'm giving the mom a tad of the benefit of the doubt. And even with that, it's still not great because the benefit of the doubt that I'm giving her is that she was probably making some kind of lame joke.
Oh, it's not straight or something.
Right. She was being funny at the time and was just an ill-advised joke.
I
I'll honestly, that's best case scenario.
I kind of agree.
But
I think.
even that, meh.
Let's not comment on our children's
parents
genitalia.
Just leave it.
No need to do any of that.
If anything, just be like, hey, son, nice dick.
That's what I always appreciated what my mom would say.
Just compliments.
Build my confidence, Mom. Just look at him and go, whoa, Jesus, put that thing away. 2 hands, son. Cover it with 2 hands.
I'm going to go on team don't comment on your kids'
Okay, maybe just don't say anything.
All right.
There's that too.
Well,
their own.
If you don't want to build them up, that's fine.
Oh my gosh. But the body dysmorphia, it sounds like... I mean, I guess it could fall into that category, but I see this maybe not so much as body dysmorphia. It's almost like a fixation. Like, I don't know. He's tying this to potentially self-esteem. And it's interesting that you're having issues together with it when it's like, I could imagine if I were a guy with a penis, if you're sleeping with different women, then it's like a new experience of like, oh no, are they going to be weirded out? Like that would be going through your mind.
Sure. But this is the first time they're seeing it.
Correct.
They don't know what to expect. There'd not the
anxiety.
Average. So what are they going to think? Yeah.
But to kind of approach that with the same, what I'm hearing is the same level of anxiety for almost every sexual encounter.
Right.
That, that rise in anxiety and worry about what your partner's going to think, that does sound exhausting for both parties.
Right.
Yeah.
For him and for you. I had just a fun little suggestion here, I wonder if this is pod therapy after dark. I'm going for it. I wonder if introducing things like, where maybe he's blindfolded and he's not able to worry about it, kind of just take that sense away and see what happens, where he's not watching or let's turn out the lights or whatever. It's more like, hey, this is still okay. You don't have to be worried about and excessively, hyperfixated on this situation.
Right.
I don't know, but if he likes to turn the lights off, then I guess it's the same.
Well, clearly he's trying to hide it. And they're still having sex, but and this is really tough, right? And I think both genders would reflect on this and relate to it. I'm sure there's been plenty of women who have said, hey, there's something about me that I'm not feeling confident about.
Oh, yeah. Women
I want the lights
totally
off.
Insecure.
For sure.
Yeah.
All humans, I think is very relatable. And I think it's tricky because I think, yes, women could feel this way about their genitals as well. But in the writer's husband's case or partner's case, that is really tricky because it's very conspicuous, and there's something about this that's there is a curvature. It's really obvious. It's something that there's a lot of fear about, will I be seen as somebody different or broken in this way? And it's really tricky because this is something that I appreciate what the writer's saying, where they're like, look, I honestly don't care.
Yeah.
And as a man, I feel like this is an interesting dynamic. I feel like if you put this writer with a group of 10 other women and she says to the other girls, I don't care, I'll bet you all 10 of them are like, yeah, no, I get it. I bet you don't.
Yeah.
I'll bet you really don't. I'll bet you're just not lying to us at all.
Yep.
I'll bet you occasionally
That's how I heard that.
Oh, yeah, you should probably get that looked at, but I don't give a shit.
Yeah.
When I'm horny and I'm ready for this, I just want you.
It.
Yeah,
You
that's
occasionally take note of it.
You're aware.
But you're not upset about it.
So
don't care. Whatever. I'm in the mood. Let's just do this thing right now. I really am not scrutinizing this.
I think
you put that dude in 10 other dudes' presence, we're like, no, she's lying to you, bro.
I do think that men's penises matter way more to men.
us. Yeah.
Yes.
They don't care.
Any women.
It turns out none of them are beautiful.
Yeah, I agree. I was like,
besides mine. But
yours is special. Yours is the glitter is very nice. The Prince Albert,
and the wig.
I love it. The wig, the Diana Ross,
the goatee.
I love the goatee.
I thought your old Afro wig was a little culturally insensitive.
Yeah, I felt,
but you moved on from that. Hey, that's all I got.
Yeah. But you bring up a good point because
now it looks
I
like
feel
Rob Reiner.
Yes.
It's beautiful.
It's plump and liberal. That's what I'm trying to say.
But I feel like women are like this with like boobs too, because men, I feel like 9 times out of 10, at least what Reddit tells me, is that they don't give a fuck. They're like, whatever.
Yay,
We don't care
boobies.
if you have extra tummy, if you have boobs.
No,
like,
don't care.
we don't care. We're having
Never
sex.
seen a bad
We're
sex.
excited.
No,
Exactly.
Never looked away. Never had a situation where I'm like, moo, I don't care about these. Nope. I'm super happy about this. Thank you for this. I'm just thrilled to be here.
But women are over here like, I need a boob job, or I need that. Like, you know, they are more fixated almost because of like other women.
But I'm happy for anybody to go get surgery to change their looks and improve them in their own eyes.
If that's what they want to do.
If that's what you want to do, because it also makes them more likely to show those body parts to me.
Oh,
That's
yeah.
Look at my new boobs.
That's
whatever it takes. Yeah.
I'm like, this is great.
Yeah.
If you
Whatever
need a
makes you
surgery to feel
comfortable
more confident,
to show me your body parts, I'm happy about it.
Also,
Jacobson,
we
he
should bring up
supports
that
it.
we have pod therapy beads that we will throw at you. If you,
I was like, anal beads.
yeah, well, yes. ¿Por qué no los dos?
Speaking of new merch stores,
It's Mental Health Awareness Month. Ba, 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 ba.
that's the sound that they make as you pull them out.
Go to the podtherapybaitshop.com. Get you some pod therapy anal beads.
Masturbate shop.
But yeah, from like a guy's perspective, I mean,
Right.
what internally, because I think men's view of their own bodies isn't really like talked about or discussed
It
enough.
is so tricky, I think, for
Yeah.
men, and like, you know, being a man, but also talking to many men. And what women want is mysterious. And like, it does vary so much woman to woman. Like, what are they attracted to? What are they interested in? And it's also tricky because on one hand, we can say you can get a group of 10 women together and ask them and they probably don't care.
Yeah.
But like, this is also the gender that we associate with being very aware. And they're the ones who would notice, hey, you have 2 different color socks on. You know, like,
That's
there's
a fair
little-
point.
On your dick.
yeah, you're wearing 2 different color socks on your dick.
One's
And
on
so
my
like there
handle.
is this nervousness of like, but women also kind of notice everything. Like they will notice that there's one
That's true.
light
We do
bulb
pick
out
apart
in
a
your
lot of
kitchen.
shit.
Yeah, they will just notice it. And they're very scrutinizing of themselves. And then they'll assure you like, no. With you, I really don't care. The lights are off. I'm in the mood. Let's really enjoy ourselves. But then there's this fear of like, but are you, because, and that's another component too, is like, I think for a lot of men, you know, based on, you know, I think conversations, there's this desire to be like, look, I know they can fake it. I know that they can just participate, but it's really important to me that this be a mutual thing and that you're enjoying this and that there's nothing off-putting about me that I'm not aware of.
There's a lot of pressure, I think, on men to like ensure that your partner is satisfied.
Sure.
That's
That's
true.
you got to
You know,
deliver.
like there's
you got to
that
deliver.
is huge. Like you have
She's
to
doing
be able
you
to
a
do
favor
this.
by being here. Okay, you just really want to make sure she comes back.
But you know, this other thing too of like, oh well, if she strays, it's because you couldn't satisfy her.
Yeah, there's
like
always
there's that fear of being judged by other people.
Right.
So there's just a lot of pressure, and so I think when you have something like this,
Yes.
where it's obviously really important to him,
Yeah.
the challenge is like he can hear you say 1,000,000 times, "Hey, it's not that big of a deal,"
Sure.
and he's never going to believe it.
It's
because
impossible
in
to
his
believe.
mind,
Yep.
this is really big. This is really
it's too
important.
obvious. Yeah, it's too obvious.
I think my biggest thought or input on this, and then I'll kind of let you guys finish up,
Nice. Pod therapy after dark.
is
We'll give you some cab money, Whitney. I appreciate you.
What?
oh my gosh. Okay, let me get my train. Okay. So my biggest thought on this is that your husband has said he doesn't want to go to therapy. He doesn't really want to go seek external help, even looking up like information online for
Yeah.
fear of the websites getting tied back to him. My thing is, what I've seen with couples or, being a woman in a relationship is going to him and saying, hey, look, I have told you so many times, I've mentioned to you, I literally don't give a shit about the curvature of your penis. Like, everything's good on my end. I wish, or I hope that you could trust me that I'm telling you the truth. It seems like you are still having some doubts, and that is starting to affect me. And I think that our partners sometimes he's seeing it from his own perspective, as we mostly do. I think when we start to see it affect our partner, like that's his deepest fear, right? That he's affecting his partner,
Right.
like by his curved penis. But really, if you're saying, hey, this is actually what's affecting me. I care a lot about you. I want us both to enjoy our sexual experiences together. And it seems like you're still self-conscious about this. If not just for me, will you go seek help? Like, I know that. I don't know that.
So I'm with you 100% on that. I think that is, of all the options available to the writer in this situation, I think that's one of the better ones, right? To just reassure and to be very clear.
Yeah, I don't want to sound like manipulative, like you have to go. But I mean, if you are feeling that
the
exhaustion,
only thing that bothers me about this is that you are bothered by it and it's distracting to you.
Yeah.
Ironically, I think that when you have a partner who has confided in you or made it aware to you that there's something about their body that they're nervous about or that they feel insecure about, as much as it may seem superficial, I'm a big fan of trying to signal to them that you like that about them, that that's not off-putting.
Yeah.
You know, like if you're dating a girl and she's like, oh, I'm insecure, I'm curvier than these girls on TV or whatever. As a guy, the clear move is to find opportunities to celebrate the fact that you are more attracted to curvier actresses.
That's actually what kind of attracted
That's my
me
jam.
To you.
Yeah, like, oh, that makes you feel, oh, well, I would never be into this kind of girl. Like, that's not my jam at all. You're my type. And like, you know, in the beginning, like, oh, you don't mean that. You know, that's not the global standard of beauty or whatever. But like, over time, if you're consistent with that, I do think it sends this signal of like, no, for real, like you are my type. And I do think that signals confidence and like over time helps them be like, look, I don't mind being sexy for you because I really do believe you that like everything that I represent, that's your jam. Like you're happy about this.
Also, I think like the behaviors matching the words is important too. You know, like, you know, from the writer's perspective, you know, if the writer is saying like over and over again, like, you know, I don't care, it doesn't bother me, I think it's perfectly fine. But then also the behaviors are, well, I'm not going to touch it. That's gross.
Yeah.
Then it's like,
well, and it's interesting. I don't know if you two, the other gentleman.
Every time you see it, you go, ew.
I don't know if the other gentlemen in the studio
flinch.
agree with me on this, but and I appreciated Whitney's point. I think she's philosophically correct. But I'm thinking about like ground level application. If my woman was telling me, hey, your penis doesn't bother me. So anyway, let's have sex. Okay, both of you get it, right? Like immediately you get like, this isn't working. Like I kind of need you to lie to me and be like, I am actually really into the fact that yours looks like this. Like for whatever reason, this works for me. I like you better. This is great.
I know
it
that
hits me in a special place that nobody else can. Like
when
lie to
you are
me.
naked around me, I always know which direction north is.
There it is. There it is.
It's
a bonus.
great.
It's
You've
a
got
bonus.
it. You got
always pointing north.
There needs to almost be a celebration of it. It's if you just tell me this doesn't bother me, that's a turnoff.
Which
Like,
way is Mecca? I don't know. Look at my penis.
my dick always knows where the Holy Land is. Bow to pray. But like, I would almost go the other way with it. Almost, well, not the other way, but I would say that like we
then
can
it
take
would just
it
be the same
further.
problem, but the other direction.
There it is. We're just turning left and left and left. I think there at some point needs to be like almost, and I don't want to be deceitful, but like I would if I were talking to the writer and I were her therapist, and as a male therapist, I was giving her male therapist advice, and she was like, dude, what do I do? I've told him it doesn't bother me. If I were giving her a hot take from a man's brain, my hot take would be, I know you didn't mean any harm. I don't think you did any harm. I'll tell you that isn't going to turn me on. I'm still going to feel insecure.
Well, I don't think you want to have that conversation like when you are like disrobing each other.
Well, definitely not then.
You want to have this conversation when you're not having.
I think that's part of it. Like
sex.
You do want to signal to them, hey, to be clear and candid, this doesn't bother me. But I would almost go a little bit further. It's like telling your woman, hey, I know you're curvy. It doesn't bother me. Mm-hmm. And she's like, great. You know,
you're tolerant of
so
it.
you accept me. I accept you as you are. I just want you to know, I know you don't look like this person on TV, and I'm good with it.
Now I'm just going to blow some raspberries into your side titty meat.
So you need to celebrate it. You need to find a way.
Just the side of it,
you
though.
motorboat son of a bitch. You got them all, didn't you? You got to go the other way with it. You got to be like, no, you know what? I know you're insecure about this. I am thrilled about it. And like, you almost have to find another celebration of this, of like, you're curved a little bit. So what? Like, it feels good. Like at the end of the day, I don't look at this thing. I feel you, and I love it. And like that, you've almost got to like give that. You know, does this make sense? Am I talking out of my ass here?
No, you're not.
This is real advice, right? Like this makes sense,
No,
right,
it
guys?
is.
Yeah.
I honestly that was my first thought, and I was thinking she had already kind of gone down that route, so I was
Right.
going for part 2. But when I
Okay.
reread it, you're right. She does mostly word
I'm
it
just trying
as
to put my
like,
brain in like the dude's
No.
perspective. And like I would need my woman to say more than just
Yeah.
this doesn't bother me. I
No,
need her to
that's-
somehow frame it as a positive and be like, look, you're insecure about this, but
Yeah.
I love this. It's great for me.
No, I think that especially men being words of affirmation typically.
Yes.
I
on,
don't
Nick.
think it hurts.
Let's see
Doesn't
your
hurt.
curvy dick and let's talk about it.
No,
All
I was
right,
just thinking
everyone
about.
drop their pants.
No.
Let
Yeah,
me
come
see.
on. Let's just drop Jacob's up. Holy shit! It's glowing. It's beautiful.
It's been running the show the whole time.
Oh my god!
I knew it looked like Jacob's evil twin.
It also has a beard.
All right, I got some advice for you, Ryder.
Let's hear
Okay.
it.
Because I think the hurdle here is that your fella doesn't want to do the therapy thing. He doesn't want the help.
Sure.
And so I think that tactics to try to kind of convince him that there is not only help to be had, but it's worth getting.
Yeah.
Because I mean that's the entire problem, as you were spelling it out for us, Ryder, is in your husband's head.
Yes.
Correct.
Right.
In both their regular head and their dick head.
And
All the
shaft.
heads.
Yeah.
Yeah. So if that's where the issue is, and I am saying now, assuming that your fella cares for you as much as you care for him,
Right.
I'm betting, I'm taking a bit of a leap here, but I'm betting that you are also not having as much sex as you would like to
Okay.
because of this. It's at least possible
That's
that
possible.
that your fella is not having sex with you at times that you would like to engage because of this issue.
Or as much sex as he would like to. 'cause
Sure,
He's
sure.
feeling blocked.
Yeah.
Yeah.
And I think that you can go down that hole with him a little bit. I think
Yeah.
you can say to him, just very frankly, look, you know, I've really worked on this. I've really tried to make you realize that this is not a bother to me at all. I love your penis. I love you. I love all these things. I can say these things because people don't grab my voice and put it into drops to be used later on the show.
Yeah.
So I can say things like, I love your penis and I love you.
God damn, somebody please.
Yeah. Well,
please.
it doesn't matter if they pull it.
Yeah.
They can't use it
They'll
on
never
the
get
show.
played. Yeah, that's true.
They can't.
It's
It's not
irrelevant.
like I can just.
It's irrelevant.
Yeah. And so I think you can have that conversation with him and just say, look, I would like for us to be having more sex. I'd like for the sex to be less stressful because this is introducing a modicum of stress to our sexual relationship as well.
Right.
I don't like that. And I feel like this is really affecting things. And I would like for us to go to a couples counselor.
Yeah.
And I would like for us to speak frankly
about
about this, frankly and Beansley about this.
There it is.
And really get to the bottom of it.
I like that.
Get to the root
Love
Get to
of
the
the
Beansley.
problem.
taint. The taint
Yeah,
of
yeah.
the issue. I like that a
Yeah.
lot.
Yeah.
Nick, what do you think about curved penises?
I like the writer. I'm fine with him either way.
Okay.
Yeah.
It doesn't bother you.
No, it doesn't bother me at all.
All right,
Of
then.
all the penises
I
he's
think that's
seen,
all fair.
he's had in
I
his
do.
life.
I do want to take a beat because this is something that doesn't get talked about enough, but it does exist. So there is an illness, a disease called Peyronie's. So Peyronie's
That's a dog.
disease.
Peyronie's.
There it is.
I've also looked it up.
That's
There
a
it is.
Peroni too.
It's pronounced, or it's
It's
spelled.
pierogies disease.
There it
Oh,
is.
I
yeah.
thought that was bottled water.
Yeah.
Oh no, it's beer.
There it is.
Peroni.
It's spelled Peyronie disease.
Yeah.
Okay.
So it is not extremely common, but it does exist, and it is the curved penis reality. And so if you're out there, gentlemen or women who love gentlemen, and your partner or you has a distinctly curved penis, again, there's nothing wrong with that. There's nothing inappropriate about that. It doesn't mean you're in any danger medically. But there is a name sometimes for that, and it has to do with particular buildups of particular scar tissue that can exist in that organ.
Mm-hmm.
And there are many, many treatments.
According
for
to
it.
clevelandclinic.org, by the way, about 10% of men report
There you go.
having Peyronie's disease.
And
Thank
it's,
you,
and,
Dr.
I'm
Jacobs.
sure
Yep,
it's
you
higher.
got it.
I'm sure it's higher, right? 'Cause
That's
how many
that's
of
why I
us
say
are-
report.
There it
Already
is.
much higher than
yeah.
what I thought it
Yeah,
Same.
it's going to be bigger than that. I saw a commercial for
That's
it the
what
other
she
day.
said.
There it is. I saw a commercial
Gotcha.
for it the other day, and they were talking about, hey, if you've got this, go to your urologist, start with your primary doctor.
I was going to say, too,
medicines
if
that
there's,
address it.
I would look into it because
Yeah.
it's clearly bothering him.
Yeah.
So, like,
Sure.
maybe there's a treatment for it.
Just to PSA this a little bit, but Ryder,
And looking at it here, by the way, some of the treatments are surgical, but there are quite a few treatments that are not surgical.
Yeah, they just have to do with addressing the tissue buildup.
Yeah, there's medicines, there's exercise, there's traction therapy, there are injections.
Yep.
All kinds of things.
And for $9.99 a month, Whitney will straighten them out. I mean, she'll just get in there and she'll work
fix
it. Okay,
a lot of things.
There's a Patreon level.
There's a Patreon level where Whitney just works
Also,
this until the problem's done.
I get that he doesn't want it like in his browsing
You'll
history.
take part of
but
my profit.
Somebody needs to teach him about incognito mode.
Oh, come on,
yeah.
bud. Get up the top right. It's the 3 dots.
I mean-
all right, click it.
Talk about a life
Come
changer.
on.
I've never heard of it.
Have you ever seen the meme where it's the Google browser and the Google browser says to the person, hey, what do you want to look up? And the person's like touching their fingertips together, like, I don't want to tell you. And then the browser holds up a sock puppet and it says incognito mode. He goes, do you want to tell him? He goes, yeah, okay.
But didn't they have a breach? Like
Oh, fuck yeah, they did.
There's
It's all
no
a
such
lie.
thing as incognito
It's
mode.
all a fucking lie.
It's just what they call it.
It's
Yeah.
Google, for Christ's
It's
sake.
pretend.
They're
still
not wasting
Google.
a drop
like
of
Heretic.
data.
Do you still believe?
Right.
Yeah, pinky promise. We're
Also,
totally
like
not
your-
interested.
Also, your internet provider, like they still record
They
all the
know it.
ISPs and
All
all
of
that.
it's
Yeah.
known.
Yeah.
Anyway, Ryder, this is a great question.
Use somebody else's phone.
Yeah, that's
Go to
right.
the library.
Yep. But there you go. Look, right next to the kids playing Minecraft. Just look up curved
Penis
dick.
picture.
Curved dick womenappreciate.com.
It's for science.
I'm learning tags. Anyway, Ryder, appreciate this question. It is a good one, and it gives us a chance to really explore some of these aspects. But, I mean, as far as you supporting your partner, I love what you're doing. I love the candor. I love the reinforcement. And it's tricky because, yep, people are different. And, I think a lot of women approach this in the way they would want to be approached with, just straight up reassurance and just being told, hey, I love you as you are. You look great. But sometimes that's tricky for men because, honestly, even saying that can feel disingenuous. And so, we almost need to just be a cheerleader for us. Be like, here's why I love this. Here's why it's great. Right. And if you want to learn more about this biologically or talk to a urologist, sure. Here's the name of something.
There's
that
a
might be
shockwave
associated
therapy
with it.
that they can use.
Oh, that
which
sounds
is use of
enjoyable.
sound waves to break down the scar tissue.
Just put a Bose radio right up next to your dick.
That's
that
it.
sounds right. And just enough bass. That's all it takes.
That's right.
Ryder, thank
I
you for
think
this
that'll
question.
do
Good
something
luck.
else to it.
And enjoy that curved
Either
penis as much as you are allowed
Win-win.
to.
Yeah.
We're going to take a quick break. And when we come back, we're talking about losing a patient to suicide. You're listening to Pod Therapy, right from curved dicks to straight up losing a patient to suicide.
Today's episode is brought to you by Judy Schneider, Leon Kassab, Carolyn Albert, Sammy Scoop, Sarah Smith, Mike Helm, Darren Cunningham, Cody the DeLorean Guy, Brady Malachek, and Polygon. Would you like to sponsor the show? Become a therapy producer at patreon.com/therapy.
All right.
Okay, trivia. Well, let's go. We'll go one at a time.
What's the
here.
topic? What are we doing here?
Here we go. Jim, you're
All
up
right.
first.
Okay.
What is the name of the Marine who dies, prompting the trial in
God damn it!
A Few Good Men?
Fuck! How did you have time to do this?
Oh, no,
He
I
already
gotta
knows it.
remember.
Ah, Jesus Christ.
He just knows this in his
Yeah.
head. Yeah.
Chat
this is-
GPT.
Are we allowed to go for options?
No.
God
Oh.
damn it. I want it to be Santiago. Is it something private? Okay. Will
He
you
does
not
have
get,
a first name.
Okay. Are you going to? Oh, fuck you.
Santiago
I have to get the
has a
rank.
first
I have to
name.
get the rank first and last name.
He also has a middle initial.
Jesus Christ. All right. Give me, I don't know what his rank is. I think his last name was Santiago. Am I right?
You're right.
Wow.
Giving them 2 points, bitches.
I'll give you 5 points if you know the rank.
Oh, Jesus Christ.
Nope.
It's Marines, right?
Sorry.
That's the branch of the military.
All right.
Yeah.
That is relevant.
That matters.
All right. That
Yeah.
does. I mean, I want it to be private because he was newish, right? But I'll bet you some caveat of private first class.
Just answer the fucking question.
Do I lose the 2 I've already gained?
No.
Private.
It is private first class, so no.
Ah.
All right.
Wow.
Fuck this game.
Oh, God, I'm not going to know these.
All right, Whitney. What is
Okay.
the name of Jack Nicholson's character?
Oh,
Do I get guessed?
Jesus.
They're options. Just kidding. Oh, my gosh. His character, Colonel.
Oh,
I don't know.
It's up there.
Isn't it?
I think you're not wrong.
It's probably Colonel First Class, whatever, blah, blah, blah. Oh, his name?
It is just Colonel.
You
It
just
is.
saw
Yes.
the movie.
I know, but I don't
Come
remember their
on.
names.
Come on, just
I
remember
barely
him
even know
yelling
Tom
at him.
Cruise's name in that.
You can't handle the truth.
Does it start with an F?
No.
Damn it.
Fitzgerald.
I don't know it then.
Frankenstein.
For the steal.
Oh, I don't know.
Jacob.
He don't know it.
Do you
I don't
know?
know it. It starts with an F though?
No.
Colonel Nathan R. Jessup.
Jessup.
Jessup. That does sound familiar.
We need options, dude.
Jessup.
All right, Jacob.
Yeah.
Let's see. What does Lieutenant Caffey frequently drink, often seen in his hand during the film?
Oh shit.
I never once said that I knew A Few Good Men really well.
Now we find out.
You're in this with us now.
Coffee,
No.
Oh,
sorry.
shit.
soda,
No.
whiskey,
No.
Yeah, thanks for the extras. I
Vodka.
appreciate you.
Bloody Marys.
He mentions it multiple times.
Yeah, he
Caffey
does.
Tom Cruise?
It's a whole thing.
Yes.
a nice Fresca.
Can I ask a clarifying question without
Yes.
disqualifying myself? Is this character Kiefer Sutherland?
No.
I just asked that.
Lieutenant Caffey is Tom Cruise.
I just said, is that Tom Cruise's character? You said yes.
Oh, okay.
Like 1 second.
I try not to listen to what you
Oh,
say.
I figured.
In one ear, out of the other.
Yeah, yeah.
Alkali water.
What is he
5,
drinking?
4, 3.
Give me Coke.
2. No.
Shit. It's gonna be an ad. It's gonna be. Come on, girl. You just watched this shit.
He wasn't drinking anything.
Fuck yeah, he was in
Pepsi.
multiple
You're
scenes.
drinking Pepsi.
He's drinking in
Go
multiple
with Pepsi.
scenes.
Go with
He was
Pepsi.
drunk on his bottle of
I
alcohol.
don't know. It's gonna be an advertisement.
It's the
gonna be something-
cola for a new
It's
generation.
probably not gonna be
Or-
beer. Go with Pepsi.
Pepsi.
No.
It's like
Yoo-hoo.
coffee. Or,
Shit.
I never saw Yoo-hoo. It was on my
Oh,
phone.
and he mentions it too. He's like, when they set up meet at my house 9 o'clock, all I got is Yoo-hoos and Cocoa
Oh,
Yoo-hoo and
he
Cocoa Puffs.
does
So if you
say
want anything
that.
else, bring it yourself.
Ah.
He says Yoo-hoo there? I just
Yeah.
heard the Cocoa Puffs.
Why is this
Yeah.
your weird kink movie? Like, why
It's
do you?
on every Saturday. I swear to God, I watch it every Saturday.
I was trying to rewatch it last night with Peter because he's never seen it. I was like, we should
he's
rewatch
never
it.
seen it?
I know. I hadn't
Wow.
either.
Okay,
That was
you've
my
got to
first
have seen
time.
clips of it.
I'd never seen a single, like, none of it looked familiar to me. Oh, that's why when he says the line, I was like,
Wow.
oh, there's that line. Then I was like, wait,
I'm
I think
super
it's
proud
been
of you
there.
for watching it.
Thank you.
Then
I watched
Yeah.
Princess Bride on the way there.
You've never seen Princess
No,
Bride?
I've watched that a
Okay,
million
thank
times.
God.
Give me trivia on that next.
Yeah, we'd fuck up Princess Bride trivia next round. Let's go, Princess Bride.
All right.
I'll bet you we're neck and neck the whole fucking time.
Now
I'll bet
I'm
you we can
nervous.
do
I've
it.
overhyped myself.
We'll dust Jacob. I'll tell you that right now. He can't.
What
do
are we
it.
betting?
Oh, shit. Oh.
Jacob's the 80s baby. He's like,
oh.
bet.
You forget what happened when you said I wasn't going to know any of that Disney trivia, too.
Oh, that's right. You stomped on us. Oh, that's right.
Doesn't
Never
Jacob
mind.
get one
Never
more
mind.
question? Or no, he started
Never
with
doubt
Jacob.
Jacob.
Never mind.
Dr. Smith knows all.
Yoo-hoo.
Here we go into the deep dark stuff. Losing a patient to suicide. Greetings, Whitney, Huey, Dewey, and Louie. All right, trigger warning having to do with suicide. Everybody has been warned. Here we go. I've written in the past, you provided dumb feedback, and well, I'm still not doing OnlyFans as a side hustle yet. Anyways, I've been practicing as a licensed professional clinical counseling therapist for less than a year, and usually I'm referred for clients who have substance abuse issues or personality disorders because I can handle their shit most days. I also find using humor in therapy useful with these populations because they can handle my sarcasm with compassion and respect. I counseled a client for 2 years who had an extensive criminal and drug history and struggled with dissociative identity disorder, but we got along pretty well. I was able to gauge his tolerance window to challenge him at times, and he appeared to handle it very well. If he wasn't, I just walked with him as he shared his struggles with me. After working with this individual for 2 years, I left the private practice to work inpatient therapy for substance abuse. Before my departure, I referred this client to another therapist I thought would be helpful to the individual. Long story short, after being gone for 1 year, I heard that this individual patient had committed suicide. I was aware that over my career, I would lose clients due to the illness or other unseen circumstances. But I was not prepared for suicide, especially when I had high hopes for this client who I cared for, but basically abandoned him when I could have stayed and helped longer. I was so angry and overcome with sadness, I would cry at times for weeks after I learned of his passing. Looking back, I would have referred him to another provider or perhaps continued to work in private practice with him. and possibly few clients until I believed that they were stable. I do wonder if he felt I abandoned him. The thought that he felt so alone does haunt me still, when in reality he was and will be one of the special clients that I respected and enjoyed working with. But he never knew that. Any insight and outright dumbass criticism would be appreciated. Sincerely, fuck myself backwards and twice sideways.
Aw.
Thanks for the signature.
Yeah.
This is interesting because we've all probably
Yeah.
dealt with this.
Oh, yeah.
And it's one of those things, I think, as a therapist, the job is incredibly difficult.
Yes.
And you're dealing with human beings, and human beings are fallible, and we are fallible as therapists. And it's really, behavior change is like the hardest thing in the world to initiate and then maintain. And to do this line of work, you kind of have to believe that you can make a difference.
Right.
Otherwise, you don't do this work.
Yeah.
Right.
You burn out, right?
Yeah.
So you believe that you can make a difference, but then there's this other side to this too, which is then sometimes you think you have more influence than you really do.
Good point.
Yeah.
And you kind of have to take both of those together. It's really hard to say, I can make a difference, I can help these people, but then not feel responsible when
Right.
things don't work out. But you can't go completely the other way either, you know? And
Right.
so it's a balance. But I do think, it's really difficult. I don't think that, I think you're in a position like most of us are when this happens, where you second guess everything that you've ever done.
Right.
In reality, I don't think it would have made a difference.
Yeah.
Yeah. I'm so sorry that you went through this. I mean, it is something that is one of my biggest fears as a clinician. It's just, it's not if, but when.
When.
You know, you're working with people struggling with all kinds of mental health diagnoses and
Yes.
disorders. And this person, you named a few that are pretty
Pretty high acuity.
yes,
Yeah.
yes, exactly. Like substance use, criminality,
Yeah.
DID. Oh my gosh, these are
So
high
many
risk
things.
areas. Absolutely. And not to say we should assume they will go down that route, but
Higher risk.
the higher risk
Yeah.
for sure. So I think, Nick's kind of right. I think sometimes as therapists, we get into a mode, or maybe this was just me,
Mm-hmm.
where you almost have to avoid this lane of trying to fix.
Yeah.
Our job is to fix this person. And we have, I guess, like Nick said, we have so much more control over their situation, when in actuality, we don't. They're in control. They know the most about them. We're here to guide, to walk next to them, to be their support when they need it. But I think sometimes we overcredit our ability to have a huge effect on their lives, you know?
Well, and that's what's tough about this is it's one thing if you have a patient who has, let's say you work in an aspect of healthcare like oncology, right? Yeah. And okay, you look at this and it's like, oh goodness, this is a stage 4, extremely severe, very unlikely of success kind of patient. I'm going to throw the best available treatments at them, but I can accept that I'm probably not going to win. And then of course, okay, this didn't work out. The patient passes away. A person in that position questions some of their decisions because they think, well, I went with this one because it has a 51% likelihood versus this other one that had a 49% likelihood. I wonder if that 49 would have been better. But they're able to look at it and say, I followed best practices, right?
Yeah.
And I did the best and I did what most other doctors in that situation would have been in. In mental health, there are an infinity of variables, right? So many. And so even if we don't change providers and we're oh, what could I have done or said differently?
Yeah.
Or just, I said this therapist sent their patient to a different provider, really did all the right things, yep, you handed this person off.
You had a discharge aftercare.
Absolutely. You did nothing wrong by moving on to a different level of care. We change jobs. It's a very common thing. By some measures, therapists change roles every 2 years on average when you look at the entire profession.
Yeah.
So you moved to a different level of care. You moved to a different demographic. It would have been inappropriate for you to continue to try to treat that person knowing that the majority of your energy was focused somewhere else. You responsibly handed them off to another professional. And we always ask ourselves, oh, well, I mean, I was a good fit for that person. Maybe that handoff wasn't a good fit. Sure. Like the first therapist
Maybe.
is always the best fit, right?
Right.
Like I've handed patients to Whitney before, you know, and like, sure. Like if they had stayed with me and I felt like I could have fit them forever, great. But there was a reason I needed to hand them off. You know, there's something else going on. And like, sure, you know, like we're going to have different roles in their lives and meet them at different chapters of their lives too. There's nothing about that that's inappropriate. Like that is the correct move. That is best practices. And the infinity of variables makes it so difficult to predict when this person's going to decompensate. And that's a whole nother aspect of this. You probably, and the therapist probably, had nothing to do with it. They probably woke up one day and went through a very hard day, and then a very hard week, and then a very hard month, and maybe lost track of their medication and stopped talking to their psychiatrist, and like so many other variables, and encountered all sorts of other environmental stressors.
That's what I was going to say, environmental stressors. Yeah.
That probably just added more to the weight of this thing, and it can't just be on one person's shoulders.
Yeah.
It's too complicated for that.
Yeah. It's really difficult to manage. And how I would even suggest, I mean, if you feel so inclined, like you seeking maybe therapy temporarily.
You got to work on yourself.
Like go see a grief counselor, even just for a few sessions to kind of process, because that is a unique scenario.
It is. Yeah. Several years ago, and I've mentioned this before on the show, but like if you go into our Patreon, we have a directory. When you first sign up at patreon.com/therapy, this is not a plug, this is just reference. There's a page at the front that says start here, and it's a full linked library to all the different interviews we've ever done, all the book reports, all the news, all the rants, just to kind of put it all in front of you, because we realize like if you just scroll through this giant feed and you try to search by keywords or whatever, like I don't know, it could be difficult to navigate. We've never really tried to. So we just put it all there as a face page. Somewhere in there is probably a selection of Jim's journals. And I had a patient die by suicide right before the pandemic. So this was probably late 2019, early 2020. And right after it happened, that night, I drove home and decided on my half-hour drive home to just turn on the microphone on my phone and just record my honest reaction to just learning that my patient had died by suicide. It was very raw. It was very real. I've considered deleting it 8,000 times since initially recording it, but I've decided to leave it because over the years, I've had dozens of students and colleagues reach out to me and say, dude, I needed that because there's no textbook on this. Like, we don't know what this is like. And getting to witness a colleague hot take react to what this was like for them was really, really important for me. And it gave me what I needed, or at least exposed me to what I can expect, so that when this happens to me, I'll be ready for it. And so I've left that out there. And Ryder, I point you to that because I think we all relate to you. We have all lost patients by suicide or overdose or parts of the behavioral health ecosystem that we are designed to treat and we're trying to fight against. And I think it underlines how important mental health is. A lot of people reduce what we do down to just being happy at work or getting over things from your childhood. And like, yeah, that's all super relevant. I'm very excited to help you be happy at work. I'm very excited to help you optimize your life and get through things from childhood. That matters to me a lot. But we are also the tip of the healthcare spear on a lot of issues that have to do with like overdosing and death of despair and self-medicating and suicide and all these other really prescient issues. And it's letters like this that I think highlight this fact that, especially in Mental Health Awareness Month, how important this shit is and how high level it is and how hard it is to work with, even when you're doing everything right. Here's this therapist saying, I was winning. I left this person in a great place. I warm-handed them off to another great therapist, and eventually things came unglued. And it just goes to show you the infinity of variables and why mental health matters and why it's something you have to be grounded in every day, even whenever you're doing everything right, because you don't know if this is going to be something that just comes unglued one day.
Yeah.
So, I mean, Ryder, I think we all agree that you handled this about as best as any of us could have asked you to. I mean, I appreciate your reflection. I appreciate you being honest and candid about this. I think other listeners of the show need to hear about this. There's patients out there right now that have had these dark thoughts, and they need to hear from a therapist who gives an honest take of like, this breaks our fucking hearts, asshole. Like, you know, and I've told patients before, listen, fucker, you better not kill yourself because I can't handle it.
Right.
I am a fragile little flower and you're going to fuck me up real good. And they're like, well, I like you a lot, Jim. Like, I don't like myself at all. Like, I don't think I should be alive, but I don't want to ruin your shit. And I'm like, you will ruin my shit.
Yes.
I will not be okay. Like, I will be a fucking mess. And like, I have a lot of work to do, Dick. You know, like, so if you care about my other patients and making things work in my world and my kids and me going to shit, don't kill yourself, Dick. Go to the psych hospital. Like, go eat Jello for 3 days instead of fucking Jim up for years. Like, go do the right thing. So
it's all about Jim.
It is about Jim, goddammit. So, like, people need to hear these messages, and I think other colleagues need to hear messages like this too. But, Ryder, I mean, I don't think we're going to armchair quarterback you on Saturday morning and tell you did something wrong. I think we look at you and think, look, you did everything correct. I think you did all the right moves. And I think Whitney's right. Like, you're going to go through a grieving process. For me, the way that I coped with this, and I've lost over my entire career, you know, a handful of clients to different variations of either overdose or suicide. And I consider overdose a form of suicide in a lot of cases. The way that we grow from this, the way that we get better, the way that we heal from this is sometimes by talking to our own therapist and working through it ourselves. And it's sometimes by sitting down with colleagues and just commiserating. I mean, Nick's talked me through some of the darkest moments of my career, you know, and I'll tell him, here's what I did, and I'll lay out all the cards. And I think the first thing I'm looking for is to make sure I didn't fuck up, you know, and he'll usually analyze it with me. And if he has notes, he's gentle about it, you know, and he knows that I'm sensitive in those moments. And so he won't tell me his notes up front. He'll usually start with, hey man, first read on this thing. You did pretty much what I would want you to do. You know, you stayed in the tradition. It was fine. You did your best part in this. There's odds and ends that I think I have some notes on, but nothing here that's crucial. And then we just talk through it. And a lot of times he would just pivot and just be like, Jim, how are you, man? You know, like this hurts you. I know you love your patients. I know you're trying your best. Talk to me about what you're feeling here. And sometimes just offloading that shit and just talking to a colleague about it. And it's a tough career, right? And, you know, Ryder, you know, you relate to this. It is an independent career. We don't do a lot of collaboration. We don't get to talk to our friends a lot. We go to our little room. We talk to our patient. We come out. We hand them off at the office. We get the next one. We go back in. We don't get a lot of collaboration. We've had a lot of people over the years that listen to the show because it makes them feel like they have colleagues that they can talk to. Mm-hmm. And they're hearing our thoughts, hearing our reflections, and it gives them a sense of normality that's really important to them. So I just
especially
tell you
difficult for people in private practice.
Oh, it's so individual.
Yeah, because if you got, you know, like if you're part of a team and you got people that you can talk to, then it's a lot easier. But yeah, when you're a therapist in private
or
practice,
to rehab, things like that, programs help. Yeah. But Ryder, if this happened, you know, in a way that doesn't give you access to other people to check in and get feedback, I really just strongly encourage you, you know, reach out to colleagues in the hallway, do your best to just join a group, a discussion group. There's always something on social media among therapists. You need that. You know, the only way that I've gotten through that in my career is just talking to other professionals. And at the end of the day, if you're the kind of professional that is destroyed by this, it breaks your heart, I'm not worried you did anything wrong. That is the nature of our work. Oncology doesn't think they did everything wrong when patients die of a disease.
Yeah.
Other healthcare providers recognize it is us versus death every day. In mental health care, sometimes we lose track of that because we think it's us versus suffering. It's us versus sadness. It's us versus a non-optimized life or a lack of awareness. And I don't think that's it. I think it's us versus death. Some patients are many, many, many paces away from death, and some patients are hanging over that cliff. And so we need to keep that in mind, and we need to support each other through that. And when we lose a patient, we need to be able to be there to comfort each other and to talk through it. So I appreciate your feedback. I appreciate this question. I love that you give us that. Hopefully we gave you insight and outright dumbass criticism that is appreciated. But just know that we're with you. We've all been through that. It is relatable. There are so many other student therapists, intern therapists, colleagues that listen to our show. And I would just encourage colleagues out there, if you're on our Discord, please join the thread on this episode, comment, give feedback, and I hope that the writer's able to jump in there and just read your thoughts and just be comforted by that. It's really important because this is a hard job.
Yeah.
And we really just need to be gassed up by each other so we can get through it. So anyway, writer, thank you for this. Very sincere question, very serious question. Glad for it. Gives us a chance to reflect. Yeah. We're going to take a quick break. And when we come back, we're talking about, is CBT out of date?
Oh boy.
I was just talking to my sister about this. You're listening to Pod Therapy.
Today's episode is brought to you by Judy Schneider, Leon Kassab, Carolyn Albert, Sammy Scoop, Sarah Smith, Mike Helm, Darren Cunningham, Cody the DeLorean Guy, Brady Malachuk, and Polygon. If you'd like to sponsor the show, become a therapy producer at patreon.com/therapy.
Here we go.
All right, Jim. What is the full name of the man Inigo Montoya seeks revenge against?
Inigo Montoya. Okay, wait. The man he wants revenge on, or his name?
The man he seeks revenge against.
Fuck.
It would have been hilarious if he'd been like, what's the full name of Inigo Montoya?
Because he says...
Inigo R. Montoya.
Yeah. Hello, my name is Inigo Montoya. You killed my father. Prepare to die.
Who's he talking to?
Well,
Or
this
about.
is not fair because he's referred to as the six...
I don't know the answer
He's
to.
referred to as the six-finger man.
He is.
And
that his full
then
name?
later on, I'm sure the character has a full-ass name that's in the credits,
Oh,
and
yeah.
I'm sure it's referenced.
No, they say it once
'Cause
because I
Prince
remember
Humperdinck-
thinking when I watched it, I was like, oh, he has a name. And I couldn't tell you
I don't
what
know
it is
what
right
his
now.
title is. I mean, he works for the prince. He's not like a duke or anything. He's probably Captain so-and-so, such and such.
I can't remember.
I'm going to go
his
with
name either.
Six-Fingered Man.
No, that is
All
not
right.
his full name.
Interesting.
It was an honest
Interesting.
shot. It was-
Whitney, do you want to steal?
I don't have a guess.
Jacob.
Oh, you don't have a guess. Interesting.
No.
Oh.
do you have
Oh,
this?
it comes to me?
You
Yeah.
have
Oh,
this?
it's interesting. The name of the six-fingered man comes... No. It couldn't come to me because Jim said that I would get stomped in this whole category.
You don't fucking know.
Draw this out.
The name of the
Draw it
six-fingered
out.
man.
The name of the count in The Princess Bride, who was referred to as the six-fingered man,
Yeah.
was he a count, Nick?
He was a count.
Holy
Oh.
You're not going to do it.
It's
You're
his
full of
name.
shit. You're not going to fucking do it.
What are we betting?
You're
What do you want to bet,
this
Jim?
is his chance.
What do you want to bet, Jim?
Did he
I'm
lure
so
Jim into a
scared.
bet?
I'm looking him right in the eyes and the confidence. This man's dick is huge.
Jim, he doesn't know.
knows the answer.
He
doesn't
showed
know,
it to
Jim.
us
Do it.
earlier.
You don't think he knows it?
No.
Nah, he doesn't know
He
it.
fucking knows. I can
What are we
see
betting?
it. I can see it in his eyes. I'll do a round. How about a round of drinks?
All right. Rugen.
Rugen.
Count Rugen?
Yep.
Holy shit! Was it really?
Yep.
It's just
What?
Count Rugen?
Count Rugen.
Never.
Dude, what? Fuck you. Why do you know that?
Never.
Why do you know that?
Boom.
The Princess Bride is a gem.
I've seen The Princess Bride once or twice.
Shut the fuck
I
up.
have too, and I
Nobody
never knew
knows
that.
that.
No, I didn't.
Ben Savage doesn't fucking know that.
Fred
Savage?
Savage.
Or Fred. Neither.
Or Ben Stiller.
Savage
Or Ben-
brother.
All the
Fuck.
brothers.
Fred Savage and Ben Stiller. Neither of them know it.
Jesus Christ.
Wow. I feel like I owe Jacob drinks for that.
God
I do too.
damn.
Insane.
This
I
one-
also feel like you have
It is
one's,
legitimately impressive.
That's impressive.
It is really
This
impressive.
one might be tough because
Because I literally thought that I was like, that guy has a
Who
name.
would
I was like,
even
huh.
know that? God.
Whitney, what are
Yeah, he
the
ran the pit of despair.
Oh, yeah,
Like,
the pit of
he helped with the-
despair.
yeah, all that stuff.
For
Helped out.
science.
Yeah.
He's like, how many sufferings have you
That's right.
I'm actually going to give this next one to Jacob. But
Okay.
Whitney, this one goes to you.
Okay.
What is the name of the region where the Cliffs of Insanity are located?
Oh, boy.
Oh, he says it on the boat ride.
Yeah.
We're in
Insanity!
Yes. The region.
That was a better impression than I thought it was
It
going
was
to be when I
very
opened my
solid.
mouth. Yeah, yeah.
Nether
Yeah, very
region. No,
Sean
just kidding.
Wallace. I like that.
This I don't know.
I mean, there's the swamp.
no,
right?
it's
not the swamp, but he says
he
the swamp.
says it so many times on
They're
that
in
damn
the they're
boat.
in the
Fire
ship.
swamp.
They're in the
No.
ship. They're coming up
I
on the
know.
cliffs of insanity.
We're in the Wabla region. They can't catch us because nobody's in the region. I can't
Oh
remember the
my
name of it
God.
though.
Cliffs of insanity.
I don't know it.
And then the
Pass.
fire swamp.
Jacob, this goes to you.
I don't know.
Oh.
Come
Any
around to Jim.
guesses?
I don't know what it is.
Gilder?
Gilder.
Oh, Gilder,
Yes.
Off the coasts of Gilder.
Yep.
The rival nation of Florin.
That's right.
Florin. Yeah,
that's
Florin.
it.
Yeah, they're in Florin. They're yeah.
All right,
Damn it.
Jacob. What 3 classic blunders?
Oh, here it is.
Oh,
What are the 3 classic
the
blunders
3 classic blunders.
Disney mentions before he dies?
Never underestimate.
Yeah, it's you never get into a land war in Asia.
There it
There's
is.
one.
Wow.
That's it.
This
You
is amazing.
It's so good.
you never get into a battle of wits with a when death is on the line.
It's Sicilian.
Sicilian.
I was
That's
like,
it.
When death is on the line.
Yeah. I would have got there in a second.
Never
The
go against the
slightly less
Sicilian.
known.
Yeah. So it's land war in Asia. Don't go against Sicilian when death is on the line.
Boy.
Something physical.
Can I have a hint?
It's kind of a trick question.
Because there's not 3.
Oh, is that just it?
Yeah, I'm going to give you points. The third one is left implied by the dramatic irony of his death.
Oh, right, because he's laughing and then just keels over. Yeah. Right.
That was very good, Jack.
Yeah.
That was extreme.
I like land war in Asia. That's
Land war
always
in
been one of my
Asia.
favorite
Land war in
lines.
Asia.
Like there are 3.
That is
less
amazing.
known.
You never get into a land
battle
war
of
in
wits
Asia.
with a Sicilian
Because
when
that's-
death is on the line.
Having just a straight up Vietnam War reference in The Princess Bride is hilarious.
Never get into a land war in Asia.
Yeah.
Oh my God, you are crushing it, my man.
Wow.
You're just
great.
I have
impressive.
pockets of knowledge
Im-
that are
Impressive.
odd.
See that.
Jesus. Okay.
As a life coach,
can I
though,
ask
that's
a
really-
question?
Yeah.
Very
Can I
valuable.
ask one of you?
Okay.
Oh, well, we'll twist-a-roo here, my man. All right, I got one for you.
Okay.
What is the name of the captain of the ship who Wesley impersonates?
Oh, come
Red
on.
Pirate Roberts.
Yeah.
Fuck. Good job.
I should have bet.
That was her chance.
Looking
Damn
back,
it.
probably could have gotten some
Yeah.
points on that one. Yeah, as far as I know, that is correct. So, all right. So Jacob's in the lead. I think is and honestly earned it. Jesus Christ.
Yeah.
That Rugen thing,
Wow.
I feel weird about it. I don't know how you cheated. But something inside of me.
I feel like Nick texted him.
You know what? Let's see the phones. I want to see search history. I want the whole
Incognito.
thing. That's right. I want the incognito mode revealed. Just don't trust it.
That's some good shit.
All right, last question of the night. Is CBT out of date? From your buddy Adam Goff. Hey, guys.
Inconceivable.
Inconceivable. I do not think this means what you think it means. Hey, guys. I've been listening to your show quite a while now. One thing that comes up quite often is cognitive behavioral therapy and its
Never heard of
benefits. What? It's I've been noticing more and more lately outside of this podcast that people are poo-pooing CBT. They talk about how it's outdated and ineffective. The science doesn't add up, and mental health providers have better tools to use now. This even came up in a minor way on your recent episode with the guest that came in when Nick and Whitney were out of town. An offhand remark was made about CBT not being a good tool. In the moment, Mr. Jim Jobin
Thank you.
audibly bristled and at a later point
Oh, he visually bristled as well.
actively defended
I wish we had video for that
CBT
one.
and its use. Now,
He looked very uncomfortable.
I got a little hot under the collar. Now, you guys are my only source of therapy and therapy information. So, if you tell me to stick my fingers in my ears and shout la 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 anytime someone badmouths CBT, I will.
I want you to do that.
But what's going
Exactly.
on?
Yeah.
Why
Life
am
coach
I hearing
Jacob.
about this more and more in and outside more often? I've had friends casually say CBT is pseudoscience. I've heard people say it in interviews on other less enjoyable podcasts, maybe half a dozen times in the last month or two. So what gives? And I apologize. I realize I'm Australian and I haven't said the word cunt yet. But don't worry, because now I have said cunt twice. Love you all, Adam Goff.
Oi, cunt.
Thank God he got those cunts in there.
Yeah, CBT. I feel like there's a big shift and
Super
a big
relevant.
movement
Super
happening right now. A lot of stuff I see online.
Spill the
is-
tea.
Oh,
A
well.
lot of tea.
I know. I think they're just honing in on how our bodies are physically holding on to trauma.
Sure.
And a lot of the things like brain spotting, EMDR, which I love. I love and support it. I think those are just becoming more of those go-to than CBT. I personally, I want to validate that movement because I get it. I think there is a progression happening there. But I don't think that means CBT is like ancient history, like it's still very, scientifically verified, backed up, all these things. Like it can be very helpful.
Yeah.
It just depends on the situation.
For sure.
Yeah.
We do have a lot of new tools.
Yeah.
Nick, what are your thoughts on that?
I mean, I come from a background in substance use.
Right.
A lot of CBT.
And also treatment.
Yeah.
Yes.
A lot of
Yes.
substance use on the way here
Yeah.
at the sushi bar.
Can you treat it if you don't know?
Yeah, exactly.
There you go.
You got to get into the chocolate factory in order to be a part of this.
Yeah. No, but I mean, it's very ubiquitous in substance use treatment, and for good reason too. I think it has been very helpful to utilize the CBT approach when looking at addictions, both chemically and behaviorally.
Sure. So okay, I have some fucking notes on this because
Jim's ready.
this shit gets crazy.
He just unraveled a whole scroll.
Yeah. Chapter 1.
Wow.
Rolled up
that
his
took a
sleeves
pee.
too.
All right, so look, here's the basic deal about this. When cognitive behavioral therapy was first rolled out, it had some really interesting features to it. And one of the things that I think made it really appetizing at the time, as different theories and different techniques were competing, it was self-evident. Like, as you presented this to people, it just made sense. And the whole theory of CBT was, hey, I think sometimes our brains jump the gun and we misinterpret something. And if we misinterpret something, I think our bodies respond to that. So the classic example is, hey, when you hear something scary, like you see a commercial for a scary disease, and then your brain thinks, oh no, what if I have that disease? Then your body experiences a panic attack. And we'd say, oh no, how do we fix your panic attack? And CBT, cognitive behavioral therapy, would say, well, let's rewind the tape. What caused the panic attack? Well, it was when I was watching that commercial. So is the answer don't watch the commercial? No. CBT would say, can't stop you from watching the commercial, but can we notice what happened in you when you did watch the commercial? Yeah, I started to think, what if I have that terrible disease that I'm scared of? And I started to think I do have that terrible disease. That's where Dr. Aaron Beck said, there is a cognitive distortion happening. Your mental perspective is getting ahead of the situation. And your brain is wondering, oh no, I might be in danger. And he started naming these different brands of cognitive distortions. That one's called catastrophizing. And he said, when your brain thinks, oh no, I might be in danger, it's not good at nuance. It's not good at understanding I'm not really in danger. I'm just scared I might be in danger. Because your brain kind of stopped evolving a really long time ago. So like when cavemen sensed danger, they should behave as if they are in danger. If they perceive that there might be a fucking bear outside the cave, they should behave as if there is a fucking bear outside the cave. That's how they stayed alive. Homo sapiens startle very easily. We run the fuck away, and that's how we survive, right? We're not like these huge apex predators that have been walking around for a million years being the biggest, baddest thing on the block. Like we kind of came to our own, and we are kind of like not the biggest, baddest thing on the block. We don't have big, sharp teeth or scary claws. We're just sort of like persistence, endurance runners and kind of clever. So Dr. Aaron Beck looked at that and he said, humans get stuck in these cognitive distortions. They fundamentally perspective the wrong interpretation of what's going on. And then all their reactions make sense to that. They will start feeling very depressed because they came from this conclusion of, I'm a total piece of shit and I don't matter, nobody loves me. And so CBT was this method of saying, hey, I know you think you're a piece of shit. I know you think nobody loves you. Can we analyze that? Can we break that down? Can we ask rational questions that slowly allow you to question this conclusion that you think you've reached? That's fundamentally what cognitive behavioral therapy is. The name cognitive behavioral therapy sounds way sexier than it really is. Cognitions, which is perspective, leads to behavior or experience. Having a panic attack, having an anxiety attack, feeling quite depressed, becoming so believing that the world hates you and that there's no point, that you go do drugs or something to that effect. So when cognitive behavioral therapy came out, it was one of many theories that was sort of presenting itself as this is a straightforward question your reality theory that probably leads to you feeling better quite quickly. So where CBT took off compared to a lot of its other contemporaries at the time, like RET or REBT or other things like that, is that it was easily testable. It was very straightforward. Now, once we stepped into this new realm of saying, hey, all these psychotherapies exist. They all have these very different ideas of how therapy should work and what the intervention should look like. CBT was convenient because it was very easy to measure. You had other people talking about all these interesting things like completing a schema and like Freudian psychoanalysis and like getting into this deep like 100 therapy session kind of like purview of how therapy was going to work. And then you had Aaron Beck in cognitive behavioral therapy being like, we think like 8 sessions, like 8 hours of working through and identifying these thinking patterns and learning how to challenge them in useful, relatable, rational ways when they're happening will probably yield measurable results in that patient's life. And whatever the presenting problem was, I'll bet you will see it diminish quite a bit.
Yeah.
So when they started doing the science on CBT, they found that, yep, it was pretty damn good at that. So cool, it started passing all these first scientific explorations and quickly became celebrated as like, hey, this is measurable, it's short term, it's realistic. Whereas you have like Freudian psychoanalysis that's talking about being in therapy for a year, year and a half minimum, going every single week. You have something that looks like a discrete unit of care that's like 8 to 10 weeks, and that's consistent with the theory. Great. But then you know who really loved that shit? Insurance companies. So insurance companies get involved, and insurances actually fund a lot of research. They fund a lot of pharmaceutical research. They fund a lot of treatment research. And you might think, oh, like, why would they do that? They're the bad guys. They are invested in finding effective, short, quick, efficient treatment modalities.
Yeah.
And one of the things that's always pissed them off about mental health is that fundamentally, the last 100 years of true research that we have across the board shows that what really heals in mental health is the common factors, which has to do with the skill of the therapist, the connection of the therapist, working from a variety of angles, having mastery of a dozen different techniques and different interventions at any given time. But that bedevils insurance companies because that is fucking hard to define. It's hard to discreetly measure into a unit of like how much I should pay for this thing. They want to know what you should do. So they start funding research in CBT when the science starts coming back and saying, hey, this is like measurable and it seems reliable. So insurance starts funding it, and then the returns keep coming back and the science keeps saying, hey, look, this shit seems to work, and it seems to work at a pretty quick rate. So insurances start telling all the providers, okay, look, when you do therapy, we're not paying for just any fucking therapy anymore. We are paying for, quote, evidence-based practices. This becomes a very interesting word because the way you should see a therapist is you should see a master clinician therapist as a professional chef. Okay? They can make a lot of different things. You can put them in a lot of different kitchens, and they are really good at cooking. And you can give them all kinds of interesting ingredients, and they will put something together that works for what that customer says they want. The customer comes in and says, boy, I'm in this kind of mood. Can you make something that works for this? They go, you know what? Let me see what I've got to work with. I'll make something for you. That's the identity of the therapist. That's the chef. But CBT is like having one specific set of ingredients. And the insurance company doesn't like a chef who can just rely on their skills. They want a vending machine that you push A7 and it spits out exactly what they expect every single time. That's what physicians do. The patient goes in and says, I have strep throat. The physician is supposed to specifically prescribe amoxicillin. That is what the insurance expects. That is what the vending machine is supposed to spit out. They know exactly how much to pay for that, and they know exactly when that should kick in and work. And if it didn't work and the patient needs further help down the line, they can understand why that went wrong and how much they should pay to fix it down the line with better things. In mental health, it bedevils insurances that they can't figure out what we're doing and when it should work and when it shouldn't work and what's going on. So they really started getting attached to things like cognitive behavioral therapy because it was this 8 to 10 session formula that they could expect to work. And if it didn't work, something's wrong. So they started telling therapists, you should provide evidence-based treatment, evidence-based practices like cognitive behavioral therapy. That went on for like 10 to 15 years. As mental health was starting to be covered by insurances and federal law was starting to tell insurances they needed to cover this treatment, and they were just routinely and systematically defying it, which they continue to do in 2025, the only compromise was, yeah, we'll do it, but like, here's what you specifically have to do. And therapists don't like that shit. Chefs don't like to be told you must make fucking SpaghettiOs over and over and over again when people order something Italian. We want to make something custom for that person. And this leads to the revolution that has happened in the profession over the last probably 5 to 10 years related to evidence-based practices generally and cognitive behavioral therapy specifically, because it's been crammed down our throats, because therapists that take insurance have been warned, you better do CBT, and I better see CBT in your treatment plan. I better see CBT references in your progress notes. If I don't see that, I'm going to invalidate your care. I'm going to question what you're doing. I'm going to claw back the money. I'm going to insult you. And I'm going to say, you don't know how to do this shit. And so that's extremely wrong. That's extremely insulting to the profession. It's extremely insulting to our training and our techniques and what we're here to do and what actually gets results. Unfortunately, the backlash from the therapeutic community has been to overcorrect in the other direction. And this is where, Ryder, you're hearing a lot of people say, oh my God, CBT is bullshit. It doesn't work anymore. There's tons of science that says it's all bullshit. And you've actually seen a lot of people in our profession almost overcorrect to like this over-spiritualized version of care, where they're starting to get into some weird shit like crystals and Reiki and like energy healing and even trauma work. Like trauma work, as Whitney was reflecting on, things like...
got my crystal over here.
You got your crystal that Whitney gave you?
Yeah,
Very good. That's helping with your chakras.
Yeah, it is. They're very aligned.
We'll do Reiki later.
Like EMDR, brain spotting. These are fine because they're fundamentally evidence-based. They have to do with processing trauma in novel ways, which is great. Like, there's nothing unique about that. They are new, flavorful twists on old, like, established concepts. But what's happening is we're seeing people go even further with that, and we're seeing books like The Body Keeps Score, which I think brings out some really important conversations that we need to have. But it turned into this, like, line in the sand, where it was like, one troop believes in this ethereal, like multi-dimensional meta-analysis of like anxiety and trauma lives inside of your cellular epigenetics, and that's difficult to prove, but like there's some hints that maybe there is some arguments for that, and it starts to get into this bucket of like, that's what all of this stuff really comes down to. And when you're telling somebody to like question their perspectives, you're actually gaslighting them. Because deep down in their bones, their body knows that they're in danger. And you're asking them to deny their deep internal intuitions, and you're lying to them. And I don't think that's correct, but like it steers so hard in that direction, in part because it's a reaction to the way that the commercial insurance industry shoved CBT down everybody's fucking throats for the last 10 years and told them they're not allowed to be professional chefs anymore and explore their intuitions and do the work they were trained to do. So fundamentally, my opinion is CBT is one of probably a dozen well-recognized evidence-based treatments. But fundamentally, beneath all of these treatments is the common factors. So I look at CBT as one particular recipe, one particular thing that's in the pantry. At the end of the day, the chef is who makes this. The success or failure of therapy comes down to the skill of the chef. You cannot just take any dumbass cook, throw them in the kitchen, give them CBT, and have them be successful. And that's what insurance wants. They want this to become a fucking vending machine. That way they can get rid of our profession and just have any asshole who's been assigned this task to give you worksheets on CBT. And so rightfully, my colleagues who were in here the other night and many other colleagues are pissed about this shit and are like, fuck CBT, because they see it as a mechanism of control and like invalidation of all their training and their work and their intuitions and their skills. To that extent, I agree with them. But I think they step too far whenever they say it's all been invalidated. There's no science about it. The new science says that all this shit's internal and invisible and spiritual. We're going too far in the wrong direction of that. So I think both can be true. CBT is a evidence-based treatment. We have lots of data to suggest that it's very useful, but that shouldn't suggest that it alone does any fucking thing. It's like saying pasta's good. Yeah, pasta's really good. But in the hands of a shitty chef like me, I'll set the kitchen on fire because I don't know what the fuck I'm doing. True. So like you should give it to somebody that knows what they are doing and they will make you something better with that box of pasta. So yes, it's useful, it's nourishing, but in the hands of the wrong person, it's fucking useless. And in the hands of the right person, any bad idea or any good idea could be useful, if that makes sense.
Yeah, it seems like a lot of clinicians today want to, instead of holding space for both, it's if CBT isn't, or if these other things are helpful, then CBT can't be. And so it's kind of like, I don't know, just isolating each one instead of saying, hey, like, I'm not going to use just CBT when I'm dealing with OCD clients. Like,
right.
You know, there's a different skill utilized there. That would not work because that's a different thing happening.
Right.
But
one size fits all, though, gets thrown on us.
Exactly.
Like, oh, did you try CBT yet? And
we'll
it's like,
throw
it's
that
not
out. And it's
appropriate.
like, well, no, some people really, really, you know, connect with that and it's very helpful for them. Other clients I work with, absolutely not. That is not, or maybe not absolutely not, but like, I'm only going to take pieces of that and the rest we're going to majorly use something else. And really at the end of the day, that kind of reminds me of being in grad school when it was really pushed like, hey, you don't want like all this a whole toolbox of things, like get your specialty, do this one.
They always did that.
Yeah, like
just get your theory and your one
your
move.
one move. Yeah, your one move, your one
Be
theory.
Be a specialist in this one thing.
Mm-hmm. You're a CBT therapist.
You're
and
a Slytherin.
That was like
always be a Slytherin.
My program wasn't like that.
Really?
No.
I feel like that was kind of like that
common.
was poo-pooed upon when I was like, oh, you don't want to be wishy-washy and just blending all these things.
We
like,
did
be a
kinda,
purist.
I mean, we kind of had that perspective of like, you know, most people claim to be eclectic, and really it's because they don't know enough about any one particular theory to use it.
Yeah.
So like that was kind of explained to us, but no one in our program ever forced like one particular thing. It was usually like you should probably have a toolbox of 2 or 3 things that you can kind of pull from.
Get good at them.
Yeah. And not just only do CBT or not just only do REBT or anything like that.
Yeah, no, ours were pretty emphasized. Like, just pick your one lane and stay in it. And right as I was graduating, in like 2010 and on, it was like, okay, well, nope, actually, it's great to kind of use different tools in your toolbox. And it was kind of hard mentally to adjust to actually like, oh, okay.
There's a lot of interesting tribalism. And I see that in grad students today. And I see that across the country. You know, I have contacts across the country in grad programs, and they'll tell me like, oh yeah, our professors strongly insist that like it's like a fucking Harry Potter house. Like you've got to pick your school of thought. Like you do karate or you do kung fu. Don't try to be fucking both. Yeah. Get really good at one. It's a way of living. And like they're
need to
like
be more Steven Seagal-ish.
Yeah. A little bit of everything. A little bit of
Russian.
Yeah. But like that's dumb.
What is the word? How do you say
How
in
you
English?
say in English?
Oh, you mean the language you've been speaking your whole fucking life?
Dummy.
You're from Michigan, dude.
Yeah.
Anyway.
Where's Michigan on a
How you say Michigan? Detroit. So yeah, but like I'm with you, Whitney. Like it's to me, I'm all for students learning to master or to get really competent in a 2 or 3 things that they really relate to organically.
Yeah.
Great. You'll probably find that you use those tools really a lot. Like wonderful. You should know how to use a hammer really well. You should know how to use a screwdriver really well. Let's start with that.
Yeah.
But as you step forward, if you're like, nope, I'm loyal to hammers and screwdrivers. Like that's dumb. Like you really are going to have
Love
to use a wrench,
screwdrivers.
right? You need to use all the tools.
I'm more of a jackhammer kind of guy.
You seem like
Yeah,
a
you are.
jackhammer kind of guy.
That's why they
We
call
talk
him
about
Nick the Jackhammer Tangeman.
That's right.
That's why they call me that.
That's ever
knew
since
it.
elementary school. They've been saying that. So anyway, Ryder, long story short, there's a lot of tea in the profession about this.
Yeah.
It is this ongoing thing.
Big shift.
I'm a moderate on this. There's a tribe of people that say we're tired of the silly mystical bullshit and we're strongly arguing just for evidence-based practices, and they tend to first lift the flag of CBT and say this is an unimpugnable hill, so we're going to push this at everybody again and say this is what's correct, everything else is a lie. I don't agree with my friends on that side, because that's the vending machine argument. That's what the insurance companies fucking want, and I don't agree with that. I think the skill of the carpenter is ultimately the thing that builds the house, not the actual tools. I think some tools are better than other tools, and I think that there's value to that. But then I have friends on the other side that say, nope, don't fucking use this tool. It's dumb. It's all a lie. And I think that that's not correct either. This tool is correctly designed. It is extremely useful. It applies to a lot of things. And you are doing your patients and your profession a disservice when you pretend that's not true as a reaction to those who have tried to bludgeon you with this instrument. So the moderate position is to say, let's follow the science. The science is tricky because the science has been skewed in the direction of overemphasizing CBT to the exclusion of other techniques because it was well funded. Insurances were writing checks to any university that said, yeah, we might want to research whether CBT works with couples. And insurance companies are like, here's fucking infinity dollars. Like, bookmark this. Send us the results, because if it turns out this works, this is going to save us $1 billion in like all the sessions that we can say are no longer valid because all that is needed was 8 sessions. And if you went over that, something's wrong. So it was abused. It's been used as a weapon against us. That's why we're very sensitive about it. But if we're being truthful, yes, it does work. Yes, it is very effective. The reason you hear about it a lot on our show is because Nick and I especially come from schools that CBT is very useful because our work is very practical work that has to do with like tangible. We need results this week. This person needs to stay sober. We need to get through this anxiety episode. There's depression right now. And CBT tends to be very like effective in short-term work. Whereas if our specialities were like long-term depth trauma work, we probably wouldn't be celebrating CBT.
Yeah.
Because that's a hammer when you need a screwdriver. That's just the wrong fucking tool.
Yeah.
And so we wouldn't be celebrating it as much.
Yeah.
But colleagues that do a lot of trauma treatment will be like, I don't like CBT for it. It's like, of course you don't.
Yeah.
I wouldn't either. It is irrelevant.
Yeah,
You can't tell people, I'm sorry, your perspective is wrong when you were abused as a fucking child.
Exactly.
Like, we have different tool sets to deal with that.
Yeah, or I do see that too when I have other social worker friends who are very engaged in the community, like financial struggles, homelessness, things like that. It's like, we're not gonna go like just see your housing
you're
situation differently.
catastrophizing.
Yeah,
I don't have any
exactly.
food. Well, that's what you think.
Yeah,
like,
so
no, really, I don't have any food.
Right, so their commentary is like poo-pooing on CBT, and I'm like, well,
Right.
yeah, that makes sense. I get it.
I would argue that's an inappropriate application of CBT.
Agreed.
But again, the insurance companies are the ones that shove this down our throats and said, always try CBT first. And I get it. I get why our colleagues are like, fuck you. Like, this is not appropriate for trauma. It's like, nope, it's not. It's not appropriate for OCD. It's not. It's not appropriate for lived problems. Nope, it's not. A lot of times it is not useful. Yeah. So in that sense, it is being wrongly applied and then pushed back against. And that's why you're hearing the gripes. So anyway, Adam, thank you.
Good question.
You cunt. We are going to take a quick break. And when we come back, we are wrapping up the show. You are listening to Pod Therapy.
Today's episode is brought to you by Judy Schneider, Leon Kassab, Carolyn Albert, Sammy Scoop, Sarah Smith, Mike Helm, Darren Cunningham, Cody the DeLorean Guy, Brady Malachek, and Polygon. Would you like to sponsor the show? Become a therapy producer at patreon.com/therapy.
Any last trivia questions you want to throw out there?
No,
Yeah.
I'm tired. I want to go home.
All right.
I've been up since 3 a.m.
Fine. As we wrap up the show, we want to remind you, you can sign up at patreon.com/therapy. You can get our extended show ad-free a day earlier, as well as enjoy our live chat Discord community and our weekly deep dives, interviews, skill shares, research roundups, and rants. This month, we have a deep dive with me exploring artificial intelligence and its ability to become conscious and how a therapist might want to react to that if that turns out to be the case. We have Nick doing a really cool interview with long-term therapy producer Slurpee Kaye motherfucker. You're one to meet Slurpee. Slurpee's a one of a kind, so a great interview there. We've got a deep dive coming up into ethical formulas and how therapists can make ethical decisions and how those flowcharts and theories kind of work, including my new theory, which I coined and I'm pretty excited to introduce. So that'll be coming out this month as well.
Boy.
Check it out at patreon.com/therapy. But Nick, we've got some new friends of the Thera Party. Who has joined us?
We have a really fun crapper named Fun Crapper.
Yeah, we do.
Our new therapod. Welcome to the show.
Welcome, Fun Crapper. And thanks to all of you, by the way, who have been going to patreon.com/therapy and signing up for the annual memberships. We have a lot of friends of the show, long-term supporters who have said, yep, I'm just going to go ahead and do that.
That's
I know I'm
awesome.
sticking around. I know I'm going to hear the season finale. I know I'm not going anywhere. Let me sign up for a year at a time, save 10%, and just let y'all know that I'm with you. We sure appreciate it. That's awesome. And so really excited to have new friends that are joining us there.
Will Pod Therapy be able to budget through the end of the year?
Dun, dun!
Find out.
No.
On the next episode.
Blew it all on
No.
sushi.
Pod Therapy.
We'd like to thank the benevolent, revered, generous, and flagrantly pro-therapy diehards who love you all so much they give till it hurts. The Thera partners Dirty B and Pickett. And we especially want to thank our bosses, the mysterious and shrouded Illuminati members of the fan club, the Thera producers. Thank you, Jake Schneider, Myra, Robert Brownie Jr. Mint, Smitty Scoop, Richard fucking Macy, Judy Schneider, Malia, Leon Kassab, Carolyn Albert, Kevin Chamberlain, Tess Miller, Dan Martin, Sammy Scoop, Slurpee Kaye motherfucker, Ben Stanley, Slapping Your Face, Sarah Smith, Adam Hathaway, Byler T, Mike Helm, Oscar Swanrose, Paris, A Sunny Boy, Darren Cunningham, Lib, Sandra McWaffle, Team Monaco, Thunder Cougar, Falcon Scoop, Heyo, Oscar Swanrose, nope, Hannah Marie, Andrew Langmead, Polygon, Emma and Tonka, Alina, Cody the Lorian Guy, Brady Malachek, Chick Fellatio,
Yeah.
and thank you for the horse penis picture,
I need to take that off there.
Gabriel
He's only sent us
Adame,
one.
and Sean
He only
Sutherland.
If you would like to hear this episode uncut and unedited
And
why wouldn't you?
and enjoy our spontaneous side projects, go to patreon.com/therapy, and thank you for supporting mental health.
Well, that's all the time we got for this week's session. We want to thank our landlords, Matt Mattingly's Ice Cream Social Podcast. And thanks to those of you who contributed to our show today. We really appreciate it. But remember, Pod Therapy isn't something you should keep all to yourself. Share the episode with the world. Tag us on the socials when you do. It's at PodTherapyGuys on Instagram, Threads, and Twitter. You'll find us at Pod Therapy on Facebook and Blue Sky. And don't forget about all the extra goodies at patreon.com/therapy.
And if you want to submit a question to the show, you can ask anonymously at podtherapy.net, email us at podtherapyguys@gmail.com, or click the link in the episode description to be taken to the anonymous
Anonymous.
I'm Nick.
I'm Whitney.
I'm Inigo Montoya.
Thanks. We'll see you for your
killed my
appointment.
father.
You killed my father. Prepare to die.
Life
the
is
name of-
pain. Anybody who tells you different is trying to sell you something.
I like it. It's just true.
What's the name of the powder? The
Oh,
odorless.
deadly iocane powder.
Yes.
What you do not smell is deadly iocane powder. Goodbye.
Bye.